aging be restored? Why do we have wrinkles on our faces? Besides topical skincare, what else can we do to defy aging?
Aging, it's actually a very complex mechanism. There are things that we are able to do to delay the aging process. A healthy body, we are not supposed to see any pigmentations.
Looks matter too. Women have been feeling the pressure.
Would aesthetic treatment create a fake look on your face? Find out 5 free ways to restore aging at Anna Hu channel. Stay tuned on Facebook Live. Hello, a very good evening to you. Thanks for catching our Facebook Live presented to you by Anna Hu channel. I'm DJ Shulin. Today we are going to talk about aging. Wait a minute, it is not just a topic for the women because men grow old too. We can't escape from the reality that we grow old regardless of gender. So today's session will definitely be beneficial to you and also to your loved ones, whether men or women. So before we proceed further, I would like to invite you to exercise your fingers a bit. Please help us share this Facebook Live to your Facebook, to Facebook groups and all other social media platforms. 各位晚上好，如果正在收看我们的直播的话呢，首先先邀请你把这个视频直播分享出去，因为我们今天要了解老化的过程。老化不只是女人的事情不只是女人怕老，男人也会老的嘛。所以呢，今天的环节有很多的资讯要带给大家，一定要先 share 好10秒钟，让大家把这个视频直播 share 出去。Please help us share this Facebook Live to all your loved ones. Once you have done so, also comment below. If you are watching with us right now, comment YES, 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 so that we know you are following us, you are listening to us, and you are watching our live video right now. Also, we have fabulous prizes to be given away worth 4,000 ringgit. So if you want to know how to bring home these fabulous prizes, do stay tuned until the end of the program. So just now I mentioned about aging. Aging is a process of growing old. This is what we all know. But what actually happened to our skin and our body? This is the knowledge that we need to learn about because we need to know the root of aging so that we can treat it accurately. So why is aging so scary? See, if we age, it is not just reflected on our face, but just imagine if we age, if we grow old, we may become less energetic, less active, or even less social interaction. If we have our loved ones, we have our parents, we have husband, wife, we have children, grandchildren, of course, we want to spend as much time with them as possible. We want to see them grow old for the parents. We want to see our kids grow up. We want to see them graduate. We want to see them marry. So it's very important to keep ourselves healthy and also, if possible, slow down the aging process. When we are talking about slowing down the aging process, well, what can we do about it? So this is a topic today. We are going to talk to you about restoring aging. So with me here today is the medical doctor of Anna Hu Clinic, Dr. Anna.
Hi Celine, thank you for introductions. Hi everyone, welcome to Anna Hu channels. So I'm Dr. Anna from Anna Hu Clinic. Anna Hu Clinic established in year 2010 with visions to assist individuals to achieve optimal health. Not only physically, not only about the physical appearance, but also in emotional and social health as well. So for the in Anahu group, what we believe in is about power of educations. We believe that educations will create knowledge, educations will build confidence, educations will connect individuals as well. So with Anahu channels, we wish to be able to empower individuals to achieve optimal health through informations from A, aesthetic, and nutrition, and A, natural aging, and we would like to provide options for individuals about optimal health, which is HOO, health optimization options. Right informations about Anahu.
Yeah, bringing them all together is Anahu.
Yes.
So let's kickstart our session today with this following video. Welcome back to Anna Hu channel. So we have just seen the video. So Dr. Anna, what does the video indicate?
Oh, this is an aging process of 80 years, happen within 30 seconds. So what you are visualizing is the aging process of a human face, facial aging. As what you can see from the video, you will notice that right from an individual started from a childhood, very young age, when they grow up to be a young adult, in their prime age, how they age gradually. So our discussions today basically will be talking about aging. So main focus will be focusing on the discussions of aging at prime age to the old age. As you can recap what happens there, what happens as we age is as we age, there will be volume reductions. And the volume reductions started right on the upper part of our forehead down to the lower part of the face. So what happens as we age? Our triangle of youth, which initially at the youthful triangle, eventually as we age it will become a down triangle. And the cause of reverse of the triangle of youth is due to mainly number one, volume lost from the inner part of the bone. Number two is due to the saggy and the gravity effect of the muscle and pulling down of the skin, leading to down coming at the anterior cheek and prominent at the lower part of the jaw, which is the commonest complaint that patients come to seek for help. Doctor, I would like to eliminate my nasolabial fold, or doctor, I would like to eliminate my marionette lines. Besides that, we do see aging on the skin as well, changes of skin color, brown color, red color due to inflammations, and appearance of lines at the crow's feet, at the nasolabial fold, the Indian line, and also the marionette lines.
To me and most people, to us laymen, aging means the process of growing old. But what is
Yes.
aging to a medical doctor?
Okay. To a medical doctor, basically, when we assess a patient's aging is actually a cumulative effect of aging over time, accumulative changes over time. So the changes that we are able to observe, example, right from the outer physical appearance, the facial aging, as what we can see from the video just now, volume lost, wrinkles, pigmentations, and sagginess at the lower part of the face. Whereas for the body part wise, when we were young, usually we will be able to sit upright because our muscle strength are strong. As we age, we notice that gradually we reduce in size and then the muscle no longer that strong. So aging process also means that there will be reductions of skeletal muscle mass, reductions of bone density, increased volume of the body fat mass, or increase the percentage of body fat in our body. So that is a little bit scary. But the scariest part is actually not about the outlook, but it's about the functionality of an individual. Because emotional disturbance in aging process, which involve in the aging process, is also very, very important. As an individual age, we realize that they tend to get less confidence, they have memory loss, they are a little bit more hesitating, especially when they make decisions, and irritability level increase. Not to forget about fear and insecurity, which eventually lead to insomnia, difficult to fall asleep or to have a good quality sleep at night, which is the emotional changes. With the combinations of physical change and the emotional change, what we worry most is the ability for an individual to be able to function well socially. Like for example, you might have grandparents at home that refuse to follow you out for vacations, or you might have parents that do not like to go out from house anymore. They feel comfortable and they feel more secure when they stay at home. Human interactions tends to get lesser as we age.
Yeah. So why do we have these changes as we age?
So all these changes are basically due to multi-factor. For example, intrinsic factor. So the way we inherit our genes through our parents. And the second commonest cause is actually due to cellular aging. I believe most of the audience do heard about shortening of the telomere, which is a way of cellular aging which is unavoidable now. And then the third possible cause is actually due to decline in hormone as we age. Commonest example are during menopausal age and also during andropause. As we age, the amount of estrogen and progesterone is getting lesser in our body, and the testosterone is getting lesser in our body. And the fourth one is due to metabolic aging. The accumulations of metabolic waste in our body, which our body unable to digest or to release out.
Yeah, you just mentioned that all these are unavoidable and beyond our control. This really worries me. Can I do anything to slow down my aging process?
Oh, not to worry. Because besides the intrinsic factor, there are other factors which is lifestyle dependent. So lifestyle dependent factors are, for example, overexposure to ultraviolet light or infrared light.
Lights or sunlight, UVA,
Yes.
UVB.
Like sun tanning, sunbathing. So if you overexpose under the sun, what will happen is actually it will increase the speed of aging, because physiologically the ability to produce or to form collagen and elastin is getting lesser, and the chances of getting damaged collagen and elastin is increased.
So when we're talking about aging, the most obvious reflection probably is on our face, is about the wrinkles. So why do we have wrinkles on our faces as we age?
Oh, okay. Actually, in reality, aging is not purely about wrinkles and lines. The reason why we age is actually because of the accumulative damage in our body and because of poor lifestyle. So what we usually propose our patients is actually to live a healthy life. Healthy life is actually extremely important because healthy life will help us to reduce the speed of aging. And if we do it good enough, what will happen is it will help us to stop the aging clock. And if we provide more than what what we use, it will be able to reverse the aging process as well.
I understand that aging is not just our skin that are growing old, but they are more than that, right?
Yes, in reality, when we are looking at an individual, like for example, when I'm assessing your face, I'm looking at your skin.
Oh my, what's my skin's problem?
But in reality, when doctors assess patients, they look beyond the surface. So we have 4 important layers of our face, right from the most superficial, the skin, down till the muscle, the fat pad, and the bone, which is extremely important for us to plan the treatments for patients and to assist them to identify what is the main cause of the aging process. Yes.
So what happened when we age? What happened to these 4 layers of elements? The skin we know, but what happened to our muscle, fat pads, and the bone? What has aging has to do with the bone?
Okay, so for example, like what we have shared or what we have seen Daniel. So if you can recall back Daniel prime time and aging Daniel, so what happened is the bone size is getting smaller. So what causes the bone size getting smaller? One of the main cause is due to lack of sleep. So the ability for the body to repair and regenerate is actually not there to preserve the bone density like what is supposed to be. So when the bone structure is getting smaller, what will happen is the attached muscle and fat pad and the skin, it will not follow the bone size to get smaller. So it will be like a curtain draping all down. And then with the help of our neck muscle, which is constantly pulling the facial skin down and the gravity, what will happen, that is the main reason why we have the anterior cheek descent and also the prominent jowl appearance.
So how can we take care of the bone? We can't see it. So is there anything we can do about the bone, the fat pads, the things that is under the skin?
Sure. So nowadays with the latest technology, what we do is actually we can restore back the bone volume lost. So for example, if you started the program of taking care of your skin late, come with prominent sign and symptom of bone loss, what we can do is actually we can restore back the bone volume using the hyaluronic acid fillers, place it on top of the bone to give it back the volume lost. However, if we only depending on the hyaluronic acid fillers without identifying what is the real cause of bony volume lost, we will not be able to assist our patients in keeping up the result for long. Maybe the result will not last as long as what it's supposed to be. So in reality, to identify the real cause of bony volume loss is extremely important. So one of the common cause, as what I've shared just now, is lack of sleep. The second commonest cause of bony volume reductions is due to malnutrition, nutritional deficiency. So generally, we will check the patient's vitamin D3 level. The patient's vitamin K2 is important, basically to restore the bony volume as well. Not to forget about the calcium, boron, and magnesium as a way to restore back the patient's volume lost, the bone volume loss. So besides the other things that we are talking about, besides the minerals, the other things that will help to rebuild back or assist our body to keep the bone volume is essential amino acid. Essential amino acid is what we commonly call as protein. Yeah, protein is also served as one of the raw mat to rebuild back the bone structure. Yeah, hormone-wise is also important. So estrogens are known to keep the bone density on check. So if a patient is menopause with severe osteopenia, the patients might want to discuss with the the patient's gynae or the family doctor options about hormone restorations as well. Yeah, all this
So-
is important.
Yeah. So what about the muscles? How can we take care of the muscles and then our skin, the outer part?
Okay, so when we are talking about aging of the facial volume, about the muscle, what we can do is actually we ask the patients not to have a facial expression.
I'm a person with a lot of facial expression, as you can see.
No, in reality, we don't do that because to be able to express what we want to express is extremely important. Especially our facial features will help us to deliver joy as well. And then when we are angry, we will need to express our anger so
Yeah.
that the other party will get to know as well. So to keep a natural facial expressions is important. However, we do advise the patients to practice on facial movement which is positive. There are positive lines and then reduce the facial expressions of the negative line. Positive lines are like crow's feet, when you smile.
So it's okay to
yeah.
laugh.
Nasolabial fold is also a positive line. And then the negative lines are like frown lines.
So don't get
And-
angry that much.
Yes, frown lines and also the mentalis muscle and depressor anguli wrist. Yeah.
This is about the muscles.
This is about the muscle. Practice on the positive lines and reduce the usage of the negative lines. So don't get angry that frequent. And then when you smile, just give a genuine happy smile by elevating the angle of the lips up.
Yeah. So when you want to get angry, just take a deep breath.
That is a way of stress management as well.
What about the skin? How can we slow down the aging of the skin?
Like what we have discussed before, so when we are talking about how to slow down the skin aging process, number one, provide whatever nutrients that the skin needs. For example, we will get the patients to increase the intake of amino acid. A way is actually increase the collagen intake. Not to forget about the antioxidant like vitamin C as well, which is important to help our body to eliminate the free radicals. And besides that, lifestyle adjustment wise are like reduce exposure to ultraviolet A and ultraviolet B, and then reduce smoking because smoking will reduce the skin ability to produce collagen and elastin. That is actually very important.
So to conclude, there are actually 5 easy ways to slow down the aging process and reverse this process. Do you still remember? They are adequate nutrition, exercise, proper sleep, hydration, and effective stress management. 那今天我们谈的就是延缓老化的过程。其实呢，老化不只是在你的脸上而已，是你的整体的状态，是我们每一天的这个生活作息非常的重要哦。要摄取这个足够的营养啦，要有足够的睡眠，不要让自己太过的压力，而且呢，就是要放松身心，去享受生活。So back to our topic today, you have mentioned so much, so we know that aging is not just about the wrinkles of our face, but it's more a holistic approach in looking at aging.
Yes.
So to achieve, you have mentioned functionality of a person, right?
Yes. So when we are talking about aging process, our main focus is actually how to assist them to be able to function optimally. So when we are talking about functional aesthetic medicines, we are talking about how to align an individual physical outer appearance with their inner emotions.
So you mentioned about functional aesthetics. So what is this all about? Let us take a look at this video.
有自信的人来说，世界好像是黑暗的。我可以一个人看戏，一个人吃饭，一个人上班，一个人下班。其实一个人的世界里 也没有什么不好。我不必跟人讲话，也不必回避别人异样的眼光。
When I first saw Kent, his skin is full of acne and with post-inflammations, hyperpigmentations. The other things that trigger me most is actually his facial expressions. He's tired and he looked very sad during that time. We go into deep discussions about his lifestyle, which is the most important core of what's going on. I think the main trigger is stress. What we have discussed with Ken, by adjusting the lifestyle, we should be able to address the issue, which is to get sufficient enough sleep, sufficient water, and sufficient nutrition.
差不多6个月的时间呢，就开始已经明显的好转了，而且 Dr. Anna 又开始鼓励我多运动，就踏出我人生的第一步了咯。从外观到内心的辅导，他已经下了很大的功夫。他的名句就是你会变得更好的，变得更好的，鼓励我从灰暗中走出，因为他给我看到希望嘛。
Personally, what I believe is optimum health. Physical health, emotional health, and social health is important to me. Why do I suggest Kent to proceed face contouring? Kent facial emotions show sadness and tiredness. We were thinking that should we align his inner self with his external facial expressions? I think our ultimate aim of treatment for patients is not to get the perfect look, but to have a functional life.
内心方面是完全是改变了啦，每一天醒来就是开心跟期待。
Ken， 接下来会希望可以看到的是你可以发挥出你生命里面最大的那个潜能，然后把自己的生活过得精彩。很感激，其实你愿意跟大家分享，希望这个分享可以温暖跟激励大家，让大家也一样有一个美好的明天。
我也是要谢谢 Dr. Anna 的鼓励，给我勇敢的踏出第一步。
To Anna Hu Channel, I'm DJ Shulin。那今天的直播呢，除了可以在 Anna Hu Channel 看到，也可以在我 Shulin 的脸书专页，可以请你把这个脸书直播分享出去，让更多的朋友了解我们的老化的过程。必须要强调的就是老化，或者是说我们要保养啊、美容啊这些事情，绝不是女生的专利哦，因为男生也是会变老的。So we have just watched a video just now. What does it indicate? Actually, what is the process that Ken has been through?
Okay, so when I first met Kent, actually he presented with one of the commonest complaints, which is acne on the face. So besides the appearance of acne, the other complaint is slow healing. So as what you can see from Kent's photo, initially there is prominent acne on the upper part of the patient's face. Not only that, there is also delayed in healing of the chin area, where there is a patch of red-brown color discolorations. So usually when the patients presented to us in that type of situations, then it prompts us to think what happens. So one of the commonest way basically for us to treat acne is, okay, you have cystic acne, then we will give antibiotics, and then we will give medicines, topical applications to apply. But if we did not cure or find out what is the underlying cause, what will happen is the moment when the patient stops the acne medicines, the antibiotic and the topical treatments, the acne will come back. So in Ken's case, what we did was we explore further what happened. So explorations, we identified that basically he's under severe stress, and that is also component of nutritional deficiency. So what we do is actually we assist him in addressing his issue by restoring the nutritions besides treating the acne component. So after a while, if you're looking back the second photo, after a while, when we reassess Kent again, then we notice that he's improving. However, while we are looking at the features of the face, we still notice that after treatments, there is improvement of component of anger compared to the first photo. However, second photo, there is still prominent sadness and tiredness as what we can see from the patient's photo. So from there, we have a discussions with Ken and then explore whether he's willing to proceed with further treatment, which is to restore back the aging facial sign. And then he's very keen. So if you're looking at the second photo at the moment, what is happening now is we restore back the nutritions in the body. Besides that, we do counsel him regarding adequate amount of sleep, and we get him to exercise, and we assist him in stress management as well. So while intervene with his internal struggle or helping him to improve his inner health, we do offer him treatments for the face to improve on the sadness and the tired looking face. So if you're looking at the third photo, that is after the emotional beauty treatment, or what we call as functional aesthetic medical treatment, where we restore back the volume at the middle part of the face and at the lower part of the face, so that to make the angle of the lips slightly uplifting, he appear happier. And when we're looking at the third photo, we restore back the volume on the upper part of the face, which is a refinement on the upper face. So the moment when we restore back the volume on the upper face, instantly he looks way much brighter. The eyes open up, the face becomes slimmer, and he appear more confident,
more attractive,
more
charming,
attractive,
more
and
handsome.
slimmer as well. Yeah. So the fourth photo is actually continuations of lifestyle adjustment, because he's already adapted to the new lifestyle and he loved it because it gives him more energy. And when we are assessing his face, he's actually not really aging compared to the initial photo, which we first start off treatment.
So you actually treated Ken from all aspects, even from the nutritional elements, and also from the emotional part of it. So it's actually a holistic approach in looking at the aging process. So if you have similar problems like Ken, you can leave your comments below, so that after our session today, we will have Dr. Anna to answer your question. Not just problems similar to Ken, but if you have your own skin problem or any problems about aging that you would like to solve, do comment below. 是的，如果今天呢，对我们今天的这些话题有一些的疑问，包括刚才你看到 Ken 的那个状况，一来到的时候呢是满脸痘痘的，如果你也有痘痘的问题，也可以在下面留言，可以更详细的描述一下你的情况是怎么样，或者是对于老化的这个东西啊，或者是怎么样抗老，任何的问题都可以在下面留言。稍后呢，我们就请今天专业的医美医生来为你解答。So, Doctor mentioned about emotional beauty just now, or functional aesthetics. What it actually means?
Okay. Functional aesthetic, basically we are talking about aligning our patient's physical appearance with their real internal emotional self, and then the treatments modality or the system that we are utilizing are actually created by one of a famous Brazilian plastic surgeons, Dr. Mauricio Di Meio. So he created MD Code, MD ASA, MD Dynacodes, and the other up and coming is actually called Next Human, which I'm very excited about.
Medical jargons. So can you
Okay.
simplify them?
Okay, that is a system for us to use to consult, to assess, to plant, and then to perform injections on patients where we are able to align the patient's external appearance with the patient's internal self, which is to allow them to be able to function optimally. So nowadays, when we are talking about aesthetic facial treatment, we are no longer talking about perfections. What we are aiming at is to allow our patients to be able to function best in life. Yeah.
So how do you actually consult a patient when they come to you?
Okay. So like what we have discussed before, when the patients come to us, we will do a thorough assessment and a lifestyle assessment as well, because that basically serve as the foundations and also the pillar for us to assist them in keeping good results. Okay. So for facial assessment wise, we have MD ASA assessment tools. So while using these MD ASA assessment tools, assessment not only on resting, we get the patient's photo in animations as well, because we want the patients to be able to be very expressive and to be their real natural self. So there are ways basically we are able to use the hyaluronic acid fillers in creating a natural look. So assessment wise, we will divide the face in upper, middle and lower, and we will mark down which are the prominent aging signs like what we have mentioned just now. So for the upper forehead, the prominent or the common aging signs are volume loss, sunken forehead, sunken temple. So when we are talking about the middle part of the face, we are talking about prominent dark eye circle, or in medical
bag.
jargon again, teardrop, and then Indian lines, and prominent nasolabial fold, and the whole volume, it might be moving 1 or 2 centimeter down. If you are talking about lower part of the face, the commonest aging signs are drooping angle of the lips, tense mentalis muscle or tense chin with sagginess at the lateral jaw. So those are the things that basically we are looking at. And when we write down each and every aging facial sign, we will need to match with what the patients want. Because usually when the patients come to us, in their mind, they already have an idea which are the area that they wanted to get it treated.
Yeah.
Like for example, commonest request is, I want to treat my under eye, I would like to treat my nasolabial fold, I would like to treat my marionette lines. So that is what the patients want.
Yeah.
And
Why not just fulfill their want?
Oh, okay. So the tricky part is usually the patients want the results of the marketing impact in the market. So for example, when we are talking about hyaluronic acid fillers treatment, the approved FDA indications is actually nasolabial fold. So when they are looking at before and after, everybody would like to fill up all the nasolabial fold. So what happened when we totally eliminate the nasolabial fold? They will look like chipmunk,
Oh.
like that. Which is number one, not natural. Number two, they will look heavier on the lower part of the face. And number three, they will not be able to express their real self. However, if we are using the MDASA, the proper system to assess the patient's face, we will know that, reason why we have the prominent nasolabial fold is because volume loss at the cheek area. For example, if you look at me just lifting at my lateral part of the cheek, my nasolabial fold improve instantly.
Yeah.
So the emotional beauty or the MD code will be able to serve as a bridge to allow the patient see what a doctor think the patients need by connecting through their emotions.
That
So-
is why we can't just treat a certain part on our face.
Yes, because usually and commonly this is one of the commonest mistake which happen in the market. That's why a lot of my patients, they come to me and then they say, I don't want fillers because my husband said don't go and get this treatment done, you will look odd, you will look weird. I need you to be able to smile. However, in reality, if we are able to assess the patients properly, if we are able to mark down which are the areas that the patients require treatment, like what you have seen with Ken's before and after photo, he is able to express himself without prominent aging facial signs. Yeah.
So it's about harmony. Facial harmony is not just treating one part of the face, but it's how we actually live our lifestyle, and also with accurate treatment, we treat the root, not just the superficial, on the superficial side or on the skin itself, right?
Yes, that's the reason why emotional beauty code now is actually a mainstay of our treatments in the clinic. The reason why is because we are able to get into the patient's real want and able to meet their expectations better. So when we are talking about emotional beauty, so we get the patients to grade for us. So we will give them a chart. So the chart, there will be 4 positive signs and there will be 4 negative signs. The 4 negative signs are anger, tired, sad, and saggy. And then the 4 positive signs are confident, more youthful, feminine or more masculine, and slimmer face. So when the patients give us the priority according to how they feel about this 8 emotional beauty, we will be able to understand their expectations. Number 1, whether they are dream of what they want or they are staying in reality. Because most of the time, if they give us eliminations of all the 4 negative signs, then we will not so stressful. However, if an 65-year-old female patients come to us and whatever things that she think is more confident, more youthful, more feminine, and slimmer face, then we have to crack our head and really plan the whole plan more thoroughly to be able to get a good results for her to meet her expectations.
Yeah, so we know that functional aesthetic is we can treat a patient in a more all-rounded perspectives. 所以呢，今天我们谈延缓老化不只是我们的脸部的这些皱纹而已，而是医生呢会看你需要些什么而调整你的生活作息，不是只是譬如说你的法令纹啊要减少，就只是把你的法令纹给移除，而是从各个方面去做一些的细微的也好，或者是比较明显的调整也好，这个调整是由内至外的。所以今天我们说的呢，除了是你的生活作息之外，你也可以选择其他一些方式。So, I would like to know that which group of people do you recommend them to go for treatment
Okay.
besides adjusting their lifestyle?
Basically, who needs treatment? It decided by the patients. Because we do have patients that are so beautiful, like celebrity, already a celebrity quality, but they still hoping to look better. And we have patients that on the face full of aging signs, but they are full of confidence. So the requirement or who needs treatment, basically it depends, fall back to the patients. When you think you need it, if you think that you can benefit from it, why not?
So aesthetic treatment is optional, but for best result, we need to adjust our lifestyle. I think this is the most important takeaway from our session today. But don't forget, we still have fabulous prizes to be given away worth 4,000 ringgit. So if you want to participate, click on the link. Click on the link above. You can see from our Facebook post and fill it. Just answer one very simple question. Do it within 24 hours and we will reveal who are the lucky winners. Of course, we still have a little bit of time for you to write down your concerns, your question about your skin problem, or if you want to know more about restoring or reversing aging. We still have a little bit of time for you to comment, for you to write down your queries and question. 好，那今天呢，我觉得有很重要的信息就是呢，我们不能够只是涂一些保养品啊，或者是去找医美医生叫他跟我这里做一点，那边拉提一点，而是我们整体的生活素质都必须要提升。那现在呢，我们还有一些的时间呢，可以给你在下面留言，特别是提出你的疑问，针对你的皮肤的问题啦，或者是延缓老化的这些提问。当然，我们有4000令吉的奖品要送出去哦，每一份呢是1000令吉，总共有4份。要怎么得到呢？非常简单，就是在我们的脸书帖子就会看到有一个链接，点进去回答一道非常简单的问题，必须要在这24小时之内完成。那之后呢，我们就会选出今天的幸运儿了。So please quickly write down your questions because we have a rare opportunity today as you can have free consultation from our medical doctor, medical director of Anna Hu Clinic. So grab the opportunity to ask questions and also to participate our prize giving session, this lucky draw. With this very simple step, just click on the link above, answer one simple question. So if you just join us on Anna Hu channel, it's okay. You can just share this Facebook Live to your Facebook news feed, to other groups or other social media platforms. You can always watch our session again and again. We have talked about so much about defying aging. Do you still remember what are the steps to restore aging? It's time to refresh your memory a bit, but I will recap just in a moment. So let's see if we have question right now. Please leave your comment below. I'm DJ Shulin right here at Anna Hu channel. You can also follow this Facebook Live on our page. So it is a very important step that we look into this process of aging. So when should we actually treat aging problem? Because I understand many people are saying, oh, when we are age maybe 25 or 26, that is when we start aging.
Usually what I will do is I will suggest the patients to start there and then. Now, this will be the best time. And then you don't need to spend any single cents in the, to practice a healthy lifestyle. So just remember, number one, to allow your body to be able to get enough rest for better repair and regenerations. This is actually one of the commonest problem that we face nowadays, which most of our clients are not getting enough sleep. So sleep at least 7 to 9 hours a day. So besides that, the other important factor which will allow us to age slower is to have balanced diet. Eat the right food at the right time, the right amount. We would propose the patients basically to have 50% of the meal portion is vegetables and 30% of the meal portions of protein and 20% of the meal portions is carbohydrates. So sugar will speed up the aging process. That is something with scientifically proven. So by far possible, try to reduce the intake of sugar. That will help to reduce the speed of aging as well. So besides that, I would suggest to patients to have regular exercise, not overdoing it as well. Because when your body is not ready, if you over exercise, that will speed up the speed of aging. So always remember to keep a balanced lifestyle, sufficient stimulations from exercise, get adequate rest in between so that the body have the time to repair and to regenerate and maybe to grow back the muscle mass which you are aiming at to achieve. Okay.
I feel like a mother is giving advice. It's true. All this advice are given by our mothers, right? Since young, our mom told us to sleep early, to drink more water, to eat more vegetables. See, doctor said that too. So remember all these simple steps, just need to persist and practice it daily. 你看是不是好像妈妈告诉我们的一样？我们从小大概可能2、3岁的时候就听妈妈说了，一定要喝多多水啦，一定要睡得好，要吃多一点蔬菜，连医生都是这么说的。所以呢，要延缓老化，从这些很简单的步骤做起就好了。Doctor mentioned just now that lifestyle is very important, maintain a healthy lifestyle. So do we still need to apply skincare products? Are the effects of skincare products overstated? Or actually with skincare products, topical skincare, it also helps. What is your view?
Okay, if you have healthy body, if you have healthy body, so when you apply topical skincare, the effect will be definitely good, right? So if your body is not really at the tip-top conditions, you might realize that no matter what skincare you apply, the skin will be still dry, the pigments will still coming out. So when we are assessing an individual's skin, like for example pigmentations or reductions of lines, we are actually trying to locate or identify what are the factors that causing the patients to age faster. So skincare applications is important as in topical. However, the priority for us is still taking care of the inner health. When the body is healthy, you will spend less on the topical skincare.
All right. We have another question from our viewer. What does pigmentation indicate? If I have pigmentation on my skin, what's the problem and how to cure it?
So there are many different types of pigmentations available. So for more information, please go back to Dr. Williams' Facebook Live, how to eliminate pigmentations. So in reality, what pigmentations indicates? Pigmentations indicates to us, number one, healing process is actually reduced. Number two, if the pigmentations is getting more and more serious, that means that the health conditions is deteriorating. So when we are treating the patient's skin pigmentations issue, we will also need to identify what's the cause and then to eliminate the possible cost before we perform laser or using topical skincare to eliminate the pigmentations. If the health conditions is good, sometimes even without any treatments, the pigmentations will be able to reduce and remove on its own. However, if the health conditions is not really that optimum, we might need the machine's help.
I see. We see that many people have a lot of intake of protein, whether to build their muscle or for their health or whatever reason. But is there side effect of overtaking protein?
Okay. So far in reality, the issues that we observe is actually patient lack of protein. We rarely see patients over intake of protein for the time being. So, and however, when we are talking about protein intake, so when you are eating it, the ability for the body to absorb is important. And then sometimes when we are talking about reason why the patients are taking the increase the oral protein intake, because we would like to increase the muscle mass. When we would like to increase the muscle mass, just by taking the oral protein supplement alone is insufficient. What we need to do is increase the protein intake. Secondly, is to increase the stimulations. So by exercise, and then thirdly, to allow time basically for our body to form or to produce the muscle mass.
We have another question from the viewer. Is there side effect of dermal fillers?
Yes. So when we are talking about dermal filler, basically we are talking about filler in general terms. So how do we classify fillers? We classify it into permanent and we classified it into temporary. So in our clinic, we do not perform any permanent fillers because we do not like the idea that the fillers being injected underneath the skin, but we have no ways basically to remove it. So in our clinic, basically what we do is actually we practice temporary fillers, and the type of fillers we use is hyaluronic acid fillers. The reason why we select hyaluronic acid fillers is because hyaluronic acid fillers is the only fillers in the market where hyaluronidase is available, just in case there is accidents happen. So what are the most dangerous, or what are the dangerous side effect or adverse reactions that doctor fear most? Number one is actually intravascular injury. So if the procedure are being done at area which is not being licensed, if the doctor is actually not well trained, so when emergency happens, we might miss the chance to revive the damaged organ. So for intravascular injury, nowadays we have ways to tackle it. Number one, prevention is always better than cure. To prevent the accidents from happening, we inject slowly. Secondly, we need to understand the locations of the blood vessel very clearly. Third, while performing the treatments, the eye, the mind, and the hand need to be with the patients. We will need to locate and to observe if there is any obvious skin color changes. So if the skin color change to a bit of bluish greens, then we need to stop the injections instantly, and then to assess again whether is this because of normal bruising or is this intravascular injury. If it's an intravascular injury, do not worry, we just highlight it straight away, and then continuous close monitoring of the patients.
Yeah, I see. I see a medical jargon on the comment. Melasma pigmentation. Do I get it correctly?
Melasma pigmentation.
Yeah.
Yes.
So what is the cause of this issue?
Melasma pigment.
Yeah.
Okay. So for melasma pigment, melasma is a type of pigmentations that I think this is very overwhelming. The question coming so fast. So what is melasma pigment? Melasma pigment is a type of brown discolorations which occur on the forehead, the nose bridge, the cheek, and sometimes on the upper part of the patient's lips. So when we are talking about melasma pigment, usually it's a type of pigments that giving us a hint that the patient's hormonal status might be become imbalanced. Patients might be under great stress as well. There is certain degree of inflammations happen in the patient's body which we'll need to address. So for melasma pigmentations, what we need to do is actually we need to, as what I shared before this, identify the real cause. Then after that, we can restore the nutritional status if the patient is having nutritional deficiency, and we can restore back the hormonal deficiency if the real issue is hormone deficiency. And by assisting the patients, adjusting their lifestyle, drinking adequate water, get enough sleep, eat well, exercise, and the most crucial part is stress management, that will be able to help them to reverse the melasma. If by oral supplement alone, the speed of recovery is not fast enough, we will suggest the patients to perform some laser treatment. But remember, Not that you have melasma straight away you go for laser treatment. Proper assessment is important because when the laser is being performed, before the body health condition is being restored, the melasma might get worse. So treatments need to come step by step, and assist by your practitioner or your doctors.
Okay, thank you for the explanation. We have a question from this viewer, Kay. She
Okay.
asked, should we start preventing aging when puberty is over?
Okay, actually, if you ask me, I would say when should we start to take care of our health? I would suggest it started right from a mother's is in her pregnancy, so that to get adequate rest, to get adequate rest, sufficient nutrition, so that the baby in the wombs will be well nourished. Maintained is the same. Actually, when we're talking about the concept, it's about the same. So maintained peace of mind so that your baby will have very good emotions as well. Sufficient exercise which will assist in delivery and then strengthen the maternal health, and also water, exercise, nutrition, sleep, and peace of mind. This 5 is actually extremely important, and then you can apply in any stages in your life, not only during puberty. But for puberty or after puberty, there are things that we need to be careful. So one of the commonest issues that faced by our patients at puberty age is actually acne, and then emotional instability, irritability, and anxiety. And these 2 main reasons are because of, number 1, they are not eating well. Nowadays, kids eat a lot of processed food, and then high sugar intake. And second reason why is they are not getting enough sleep. We are competing with the gadgets to get enough sleep. This is also the commonest complaint from the parents as well.
So we need to go back to the basics again of our lifestyle.
Yes.
So the next question, we still have, we can take one more, okay? Because I saw one more coming in. Switching us, is chemical peeling safe?
Yes, chemical peeling is safe if you are done under a safe hand, but do bear in mind that there are, generally we divide chemical peel in different categories: superficial peel, medium peel, and deep peel. So if you do it in a salon, usually they will only go up till like superficial peel. So when you are in a dermatologist clinic or in the aesthetic clinic, maybe they will go up till like medium or medium peel. So when you are performing the peel, number 1, you will need to understand what type of chemical peel that they are using. Are they using a glycolic acid? Are they using salicylic acid? Are they using a combination of acids like Jasner peel? So all this will impact on the treatment results. And if we are talking about medium and deep peel, generally there will be about 5 days to 2 weeks type of downtime, but generally in Malaysia, very rarely we will do deep peel.
Yeah, so what Dr. Anna has explained, I believe it will give you general knowledge about the condition, but I believe every patient's situation is different. So if you really want to cure your issue, your problem, do consult an aesthetic doctor. So before we end the session today, any words from you? Especially we would like to know, what is your vision and mission in the aesthetics field?
Okay, so since the establishment of our clinic in year 2010, we always believe in optimal health. So we would like to assist individuals in achieving fulfilling life through optimal health. And right from initially, we are only able to cater or to support physical health, which is physical appearance and the body health. Now we expand the horizon up to assist individuals in improving to optimize their emotional, and eventually, hopefully in the future, social health as well. Because just by doing the optimized physical health alone is actually not able to assist our patients or individual to achieve a fulfilling life, because we realize that physical health and the internal emotions, these two work hands in hand. And then eventually when you have healthy body, you have healthy mind, then only we will be able to function well in our social cycle. This is extremely important. So besides, we would like to remind, or we would like to share our knowledge with the public, in the sense that you don't really need to spend big money to have optimal health, as in healthy physically, emotionally, just by practicing healthy lifestyle. Remember, sleep early, get a good quality sleep, eat well, eat right, eat sufficient amount, eat at the right time, and then drink sufficient amount of water, and then exercise when adequately, not excessively, and lastly, practice peace of mind. Know what is important to you, not only to take it from the community, but to be able to give back is actually the best present we can provide.
Yes, a very solid summary by Dr. Anna. Thank you so much for the wonderful and fruitful sharing today. And for you who are watching, we still have fabulous prizes to be given away. So do not forget to click the link on this post. Just answer one very simple question in 24 hours time. We have 4 prizes to be given away, worth a total of 4,000 ringgit, which is 1,000 ringgit each. So to join this contest to bring home fabulous prizes, I'm DJ Shulin. Thanks for watching our Facebook Live. Do catch us at Anna Hu channel for more updates and information. Wishing you a very good Friday evening and a great weekend ahead. See you. Bye-bye.
Bye-bye.
Can aging be restored? Why do we have wrinkles on our faces? Besides topical skincare, what else can we do to defy aging?
Aging, it's actually a very complex mechanism. There are things that we are able to do to delay the aging process. A healthy body, we are not supposed to see any pigmentations.
Look fatter too. Women have been feeling the pressure.
Would aesthetic treatment create a fake look on your face? Find out 5 free ways to restore aging at Anna Hu channel. Stay tuned on Facebook Live.